My name is Ciaran Nicholl. I have the pleasure and the honour of working in the European Commission's Joint Research Centre. We are working on six of the big, what I call cancer killers. The lung cancer guidelines are now one of the later ones. So already the call for experts has taken place last summer. Over 150 experts applied. There are some studies now going on to look at the settings in Europe about designing the guidelines for European settings. Also, there will be meetings of the expert groups set up in early 2026. So by the summer of 2026, we should be at full speed ahead, where the working group experts will be working together with patients, with patient advocates on developing evidence-based guidelines. I think SOLACE is excellent. The pilot studies it is doing, looking at high-risk groups, looking at reaching patients in all corners of Europe, this is super important. So the key for success in Europe will be to work together. That means complete transparency and openness together. In Europe in the past, we've often had many initiatives, maybe not always aligned together. So with SOLACE and the European Union guidelines, they need to go hand in hand together. Now, what SOLACE and the wonderful colleagues and experts will learn, they will see the reality in the member states and what the challenges will be. This has to feed into our work and vice versa, so that when we come up with those guidelines and quality assurance scheme, they will be tailored to address the challenges in Europe. In terms of policy needs, I think we need to implement in Europe what we develop in Europe. It's very important that we have sustainable solutions, that we don't do something, put a lot of work into it and then walk away. So comprehensive cancer centres, networks that we've set up, for example, the network of cancer registries, the guidelines. And good news here is that the guidelines that we produce for the main cancer killers are being updated and will be updated in quasi real time. So that means when new evidence becomes available and when the experts check that evidence for applicability in all corners of Europe in an equal population-based way, that those guidelines will be up to date in quasi real time. This is very important because technology is changing. Look at AI coming in. That will transform healthcare settings, hopefully in many ways for the positive, and we need to keep up to speed with that. So long-term solutions, setting aside political steps to continue in a sustainable way, while also incorporating the latest science and technology in an independent, evidence-based way.